Hello and welcome. My name is Michelle Benitez, and I'm a librarian at Stanford Health Library. Thank you for joining us for our presentation, Medicare and Employer Health Insurance, Navigating Coverage While You Work, presented by the Health Insurance Counseling and Advocacy Program, also known as HICAP. Maha Justi is a volunteer HICAP Medicare counselor and is certified by the California Department of Aging. Maha has been assisting Medicare beneficiaries for the past 16 years with all of their Medicare questions. She is a retired Silicon Valley engineer who enjoys helping seniors and their families navigate complex Medicare issues. If you have any questions during the presentation, please enter them in the Q&A box below. And I will turn it over to you now, Maha. Thank you.
Thank you, Michelle. And thank you to Stanford for hosting yet another Medicare meeting. We have a busy night, and we'll try to have it have points where I will stop and you can answer. You can ask questions, which I'll be happy to answer. Let me pull up the presentation and we'll get started. So the topic today is about Medicare and employment. As Michelle said, HICAP is an acronym for our program. This is only in California. The program exists in the entire country, and the rest of the country is called CHIP, which is a state health insurance program. Our goal is to educate, assist, and advocate. Our service is free, unbiased, or confidential, where we don't endorse, sell, or recommend any particular health insurance companies. There is a service in every county in the entire country. It's really meant for Medicare beneficiary to be able to sit down and talk to a real person as opposed to calling the 1-800 Medicare number. It is federally supported, but very little support. And we're kind of sitting on the edge of our seat to see if they're going to cut the program or not. But it is mostly volunteers based. So you would find in every county, you might have 2 people in the office and 20 to 50 people volunteering to help beneficiary. The agenda today has 2 parts. The first part I always like to start with is a briefer, just a refresher about Medicare and the terminology, not specifically employer-based. And then I go into what happened when Medicare, when you're working and when you're about to retire and when you actually retire, and go through some scenarios. I'm going to have a break between the 2 sections, so we'll stop and take questions. So let's start with the basics. When we talk about Medicare, we're talking about something called original Medicare. Original Medicare has 2 parts, Part A and Part B. Part A is institution, hospital, skilled nursing care, and so on. Part B is medical services. It has to do with doctors, outpatient services, and so on. You get this card. The program is a federal program. To enroll in the program, you go through Social Security Administration. They're the agency who have your work record, and this is where you enroll. Once you are enrolled, then the agency that manages the program is called CMS. It's just a Center for Medicare and Medicaid Services. So who's eligible for Medicare? Well, people who are 65, work history, you have to have 40 or more quarter of Social Security covered employment. This is where you actually work and pay your Social Security Medicare tax. Relation, you might not have 40 quarter yourself, but you're married to somebody who has 40 quarter, so you can get it on a spouse's record. You could also get it on a divorce spouse's record. It doesn't affect their benefit. This is just this is an extra for you to be able to access Medicare. You could also get it if you have certain disability. End-stage renal disease or ALS are two of the illnesses that you can get Medicare regardless if you ever worked or you're married or not married and so on. So there are many enrollment periods, but I'm just going to go through the very basics. So there's something called initial enrollment. When you're 65, you have a period of 3 months before the month of your birthday and 3 months after. This is a time where you are able to enroll into Medicare. So it's a total of 7 months. There's something called annual enrollment period. This is for people that are already on Medicare and they want to review their options. So this is always happen October 15th to December 7th. There's something called special enrollment period. This is especially relevant to people that don't take Medicare while they're working and delay it. So this is, they go something called special enrollment period. And the triggering event would be stopping work. That could happen anytime. And I will go more into details when we get to the next section. Now, Medicare is not completely free. So if I go very quickly through some of the expenses with the original Medicare, you have Part A and Part B. There are premium. If you work for the quarter, you don't pay anything. The premium is zero. You could buy into Medicare. So for example, if you didn't work or you worked small amount of quarters, you could buy into it, and that buying into it, it costs $518 a month. Part B is a flat number that changes every year. This year is $185 a month for most people. The reason I say most people is if your income, if you're filing joint, if your income above somewhere around $200,000, then your premium will be indexed. It's called IRMA index, and it goes up from there. Deductible. So most people understand the concept of premium. Then there's deductible. Deductible is the amount that you have to pay before Medicare start making payments. So in this case, for Part A, is this year is $1,676 per benefit period, and benefit period is 60 days. So this could really roll multiple times throughout the year. So that could add up quite a bit. The Part B deductible this year is $257 for everyone. It's not indexed by anything, and it's just a flat number that you have to pay yourself per year. Once you have done that, then there are copays. Now, from hospital, the first 60 days in the hospital are zero copay. After 60 days, there is a copay. Part B goes 80-20. So Medicare pays 80% and you pay 20%. So when you look at all this, you can realize, gee, I have Medicare, original Medicare, but that's really not enough coverage. You're financially exposed to a lot of expenses that are unlimited. There is no out-of-pocket maximum with original Medicare. So it also doesn't address prescription drugs. So because of that, people supplement this Medicare, the original Medicare, and I call it a Medicare package. So you get your A and B federal program, and you supplement that with two private insurance. One is called Medicare Supplement, which is another word, they call it Medigap, and this is purely financial insurance. It pays, depending on which one you pick, which insurance you pick, it pays potentially everything that A and B does not pay. So, but the Medigap insurance company have zero influence or decision-making on your health insurance. I mean, your health decisions. They just a payment plan kind of a thing. The other part, private part that you can go out and buy is called Part D, which is prescription drug plan. So as you see, this package is a combination of federal and private. That's not the only way you can get Medicare. There is an alternative, and the alternative is something called Medicare Advantage. Medicare Advantage basically are private company, completely private companies that went to the federal government and say, oh, we can do a better job than you guys could do. So just whatever you get paid here in premium, part A and part B, give us this money and we will manage everything and take the beneficiary off your hand. So you don't need a supplement, you don't need anything, you just need one plan. An example of that would be Kaiser, is one option that people can go for. But it's very important to realize that once you're here and you stay on it longer than 12 months, you can always go back to A and B, but you no longer can buy a Medigap plan, which is a financial plan to help you mitigate these expenses without underwriting. They will ask you for underwriting. If you go this route initially, or stay here less than 12 months, then you can go back without any underwriting. So that's important to understand. So it's very roughly the difference between the two. And we've done a lot of presentation about the details of Medicare and Medicare Advantage that you can go back to. And I always say Medicare Advantage is a marketing name. It's neither an advantage nor a disadvantage. It's purely an alternative to the original Medicare package. The feature of Advantage plan are they tend to be very regional. So most of them are HMO. There are some PPOs, but they're mostly HMOs. You always need a referral from your primary care physician. So the only exception is if you're traveling somewhere and you have an emergency, meaning you end up in an ER, then you could go there even if your plan is regional. Emergency are handled separately. Now, on the other hand, if you have an original Medicare and you buy a supplement, they are nationwide. You could go anywhere in the country to any doctor that takes Medicare. It's not an HMO, it's not a PPO, it's called fee for service, meaning if that doctor has a contract with Medicare and he takes you because they have an appointment or take a new patient, then you're good to go. So there is no preferred network to talk about. Everything is open to you. There's also self-referral. Self-referral, you don't need a primary care physician, which is sometimes good and bad. It's good to have a primary care physician overlook all your whole person. However, if you know, for example, that you need to see a dermatologist, it might be counterproductive to have to wait to go to a primary care physician so he can allow you to go to a dermatologist. But it's just a personal choice. People can choose whatever they want, and there is no good and bad. This is just different. Okay, so just to review that part very briefly, you can have either original Medicare or Medicare Advantage, but not both. So it's either or. Original Medicare package is a federal private insurance. Medicare Advantage is completely private plan. So you get people that have a Medicare Advantage, they have a problem and they want to call Medicare. And Medicare, CMS have nothing to do with it. They say, well, it's a private plan. They have, unless they're really committing fraud or something, you have to deal with that private insurance. You have nothing to do with 1-800-Medicare. You can stay on Medicare Advantage. If you do that over 12 months, you are not guaranteed to buy the supplement. So this is something very important that we tell people up front. As long as they understand and accept that, that's all is fine. The worst case is that they don't know that and they say, if somebody had told me, I would have made a different choice. So believe it or not, many people don't know what they have. If you ask somebody, which Medicare do you have? They would say, I have ARP or United Healthcare. But those are companies, those are not really plans. And somebody like ARP, United Healthcare, they do sell Medicare Advantage, they do sell Medigap plan, and they do sell Part D. So telling somebody that you have United Healthcare doesn't really say anything about which coverage do you have. So um, um, not, not aside from employment altogether, again, just as a final summary, you can have this package, or you can have the alternative of Medicare Advantage. You cannot have both. So that's kind of like the very, very quick summary of the very, very basic. Do we have questions at that point before I go dive into the topic for tonight?
Thanks, Maha. Let's see here. Gosh, some of this Medicare stuff, like it seems like another language. Okay. With Kaiser Advantage, Part C, are there still gaps in coverage that Part G would cover if you had that instead?
So we can there are too many things going on in that. So when we talk about a gap, um, we're talking there is if you have a Plan G, which is a Medicare supplement for A and B, right? So with that plan, the only thing you end up paying is your Part B deductible, right? So that's the only gap you are liable for. If you have F, which is no longer available for people that have became eligible for Medicare after 2020, January 2020, F literally paid everything. So you paid your Medicare premium, you pay your supplement premium, all your medical is completely covered. Now, the best you can get today is G, and the only thing that is missing in G is that $257, which is, not a bad deal. But everything else will be paid, provided you are going to a Medicare doctor, of course, and what you're doing is medically necessary.
Thank you. The only other question, and thanks for submitting the questions, everybody, is, and maybe this employer section will answer this a little bit because they're asking if they can still go to Kaiser if they have original Medicare.
If you have original Medicare, you could always go to a Medicare Advantage. It's the problem the other way around. If you are Medicare Advantage, you can go to original Medicare, but you may not be able to buy a supplement without underwriting, depending how long you've been on the Medicare Advantage.
Thank you. Let's see. I think you're going to get to, I think that's all we have that you're not going to get to in the next part. So we're good to go on.
We'll go on now to the next part, which is employer. So we talk about poor economic conditions has caused older adults to work longer. People used to retire at 65. Well, it's not just, in all fairness, not poor economic conditions. People are living longer and they want to be stimulated, they want to be engaged, so they end up working longer than 65. Many people don't realize they have to start thinking about Medicare before retiring because there's a substantial decision you have to make when you actually retire. One source of confusion is unless you were born in 1938, I think, the full Social Security age is 66 plus to get your full benefit. The Social Security benefit itself, you can take it as early as 62, but it's going to be discounted, or you can take it up to when you're 70 years old, and at that time you get the maximum you can ever get. It doesn't increase beyond 70. Now, Medicare is fixed. Medicare is 65, period. You get Medicare when you're 65. Many people don't know when to sign up and get bad advice. And honestly, to say that HR department in your employer, they're really, really good explaining their own health plan. But when it comes to Medicare and coordinating with Medicare and COBRA and all these things, we see a lot of wrong information given to people. So when I say everybody has to sign up or at age 65. So when you're 65, you should be enrolled in Medicare. What happens if you don't? Well, there's in Part B, there's something called late enrollment penalty, which is 10% of a standard premium for every 12-month delay. So remember I said like the premium is $185. So that 10%, if you delay every 12 months, keeps adding up, and that penalty stays with you for the rest of your life. Part D, late enrollment penalty, is 1% of the national average for every 1 month delay. So you might have a plan that says the plan is $1.80, and we do have a plan that's $1.80 a month. And you say, well, $1.80 at 1% is not a big deal. However, the national average premium is a completely different number that the insurance company come up with before they discounted with the insurance commissioner, and that number is somewhere around between $30 and $40. So that can certainly add up. The other thing is Medigap. There is a federal guarantee to buy that supplement, and that federal guarantee is 6 months from the date your Part B starts. If you sign up by a Medigap during these 6 months, the insurance company cannot allow to ask you anything about your health. They have to take, it's guaranteed enrollment. They have to give you the same price as everybody else. If you fall out of that 6 month, then all bets are off. They would subject you to underwriting, or they could charge you more. So it's really important to understand that the 65th birthday is really an important date for Medicare. Well, so what happened when you're working? Well, when you're working, you typically have an employer group health insurance plan, not a retirement plan. This is an active employment. So if you have active employment, the CMS, Medicare, made an exception. And that exception says, okay, if you are actively employed, you don't, and your employer has larger than 20 employees, you really don't have to sign up for Medicare. That goes also for your family. So if your spouse is 65 and wanted to stay on your employer health plan, they will be able to come later and the penalties would be waived. So the penalties are there because you're supposed to sign up at 65, but there's a provision that could waive these penalties. For the employee, if you're working with an active employer plan and you are at age 65, the employer has to offer you the same plan they offer as people under 65. So they cannot discriminate and say, well, now you're 65, we're going to give you a different plan. They have to offer you the same plan. It's your choice, but they have to offer it to you. If you're a small employer, it's a different regulation. You do have to sign up for Medicare then. Another thing to notice or to be aware of, if you are enrolled in Social Security, you're still working and you decide, for whatever your reason is, you decide you're going to take Social Security. If that happens and you become of Medicare age, Social Security will enroll you automatically. So if you don't want to be double coverage, then you have to opt out. Most people don't take Social Security while they're working, but some do. So you just need to be aware that you will be automatically enrolled. If you don't enroll in Medicare, you can, it's a choice. You could stay on your employer plan, and don't have to go into Medicare, but you can go to Medicare. And in the past, employer plan used to be really good. And some people, there was a no-brainer. You have an employer plan and you become eligible for Medicare and your penalties are waived. You stay with the employer plan as long as you can. However, we have seen that employer plan been really degrading over time. So then we tell people to stop and compare because your employer plan may not be the best. So if you're actively employed, again, you have an option. You could stay on your employer plan. You could forget about it. You could say to your employer, thank you very much. I don't want this plan anymore. I'm going to jump over and go to this Medicare package, or I'm going to this Medicare package. It's your choice, but these are the options that you have if you are actively employed. But now you are thinking about retiring. What do you have to do before you actually retire? So 6 months before you retire, ask yourself a question. Do I have a health saving account? Am I contributing or is my employer contributing? And ask, does that need to stop? And let me explain a little bit because we have seen recently quite a number of people that run into these issues. So first, what is an HSA account? HSA account is a health saving account that's made out of two pieces. One piece of it is a high deductible health insurance plan, and the other piece is a custodian that you put money in for your HSA to use. So when you have these two things, you can make contribution and you take distribution throughout the year. Contribution can be done by you, can be done by your employer, can be done by your relative. It could be done by anyone on your behalf. And each year there's a contribution limit, so you cannot put unlimited number amount. The contribution is tax deferred, so it's attractive for people because they basically have this plan and the money goes in there. It's their money forever. So it's like the IRA, and when they take it out for medical expenses, it's untaxed. So it's actually the best IRA that you can imagine. Sometimes it's called the secret IRA. So well and good, people have that, an HSA account, but then they become eligible for Medicare. And here comes the problem. The problem is Medicare Part A is free. So many people that turn 65, they're working, and they say, well, I don't have anything to lose. It's free. I signed up for it anyway. Even though they have an employer health plan, they sign up for it anyway. In general, it's not a problem. Only a problem if you have a health saving account. Why is that a problem? It's a problem because Medicare is not a high deductible insurance. So you're supposed to have a high deductible insurance, and Medicare does not fit that requirement. So if you do that and you're trying to shelter your contribution, you're going to get in problem with the IRS. So that's the first problem here. So in general, Medicare beneficiaries are not eligible to make any contribution to their HSA account. They still can take money out. It's their money forever. They can put it in their trust or will to somebody else. It's their money, but they cannot add more money into that account. The other complication is when you enroll in Part A, your coverage is typically deemed eligible for 6 months prior to your enrollment date, but never before 65. What does that mean? What it really means is that let's say you're 70 years old and you've been contributing to your HSA account all along. And then all of a sudden you decide, okay, next month I'm going to retire. So you switch over, but up to that month, you're still paying for your HA, you're still making contribution. Medicare has deemed you eligible 6 months before. So all that 6 months contribution are basically illegal. So you have to kind of watch out for that. And I will give scenarios later on, so to kind of drive that point further. What else? Well, look at your employment plan, retirement plan. So in the past, people went on autopilot and they say, well, employer, I have an employer plan. I'm just going to go into my employer plan, forget about Medicare. But we say stop and evaluate. We're talking about retirement plan now. Your retirement plan with your company may not be, and in most cases, is not the same as your active employment plan. They're completely different plans. So you actually need to really understand what is a retirement plan versus your employer plan. Some employer have the same, but most don't. So what do you ask? You ask, what do you have? Do you have an HMO? Do you have a PPO? Is it something like similar to a fee for service, what I get with original Medicare? You need to ask these questions. Can I switch? Can I go from HMO to PPO during open enrollment? And so on. These are the things that you have to ask your employer. Cost, premium. If you have once you retire, you have to sign up for Part B, A and B costs money. So what additional premium you have to pay on top of the Part B? So a lot of people forget that, and they think, oh, I'm going to take my retirement plan, and here it says I pay $250 a month. Sounds like a good deal, but in reality, they forget that they still have to pay that Part B premium as well. Deductible, you need to ask and compare to the Medicare package or a Medicare Advantage that you get off the shelf. Individual versus family coverage. Some people stay on a retirement plan because they feel, okay, my company give me coverage for my whole family, and I want to keep it this way. Medicare is individual. It's just for you. Long term, this is the thing you have to think about. Again, if you decide to go with your employer retirement plan and you stay on it for longer than 6 months after you signed up for B, and then you decide, after all, I really don't think this plan is good for me. I want to go back to original Medicare. You could, but you may not be able to get a Medigap because Medigap is only 6 months after Part B. So this is something very important to realize. The only exception, there are some exceptions. The exception, for example, if your company decide we're gonna completely get out of the healthcare business, and that happened, for example, a number of years back, IBM decided we're no longer gonna pay for any kind of health insurance, so we are actually getting out of that health insurance altogether. At that time, you get the guarantee back, but short of that, you have to really make a wise decision up front. And the risks that you take with the employer plan, some employer plan, again, are very good and they stay good for a long time. But as time goes by, your employer, at their discretion, could change the plan. So every open enrollment, they could say, well, I think this year we're only offering HMO, and HMO with this network, take it or leave it. So that doesn't really leave you option. You're kind of stuck in that scenario. So this is the kind of thing that you have to think about. Again, if you're working for a large employer, that does not happen, but it does happen. You need to be aware of the risk you're taking. You need to do, well, you obviously need to, once you retire, before you retire, 1 to 3 months before, that's your kind of, you need to plan it and actually sign up for original Medicare, because you need that when you retire with your employer plan. So if you retire at 65 on your own work record, it's easy. You sign up online, mysocialsecurity.com, because remember, Social Security is the agency that they have your work record, so this is where you sign up. Or you can call for an appointment. Unfortunately, this is becoming a nightmare right now. You try to get a call to Social Security office, and it seems to be really chaotic. So if you have the option to sign up online, this is the best way to go. If you're retiring at an age over 65, so you are working, you're happy working, but let's say at 68, you think, okay, I had enough, I'm going to retire now. So in this case, there is no option to do it online. You have to call for an appointment. And basically, if you call in for an appointment and they ask you, well, how old are you? You say I'm 65 and 68. Well, where have you been? You have not signed up for Medicare when you're 65, and you're subject to all the penalties. And you say, oh, I've been working, actively working. They say, okay, take this form, and we tell people to do that ahead of time, right? So you don't have to call again. Take that form to your employer to verify that you were actively employed and had a coverage through your employer. And with that, your penalties would be waived. And that you can do anytime because once you want to retire, you get this something called special enrollment. So special enrollment could be any day that you are retiring. You said, next month I'm retiring, you have special enrollment, you get this form filled out, you call for an appointment, and you get it done. So what are the options? Uh, the options are you can go to original Medicare, you could have a Medicare Advantage, you could have your employer plan. So the employer plan could come in two varieties. The employer could say, okay, original Medicare and a supplement. And this supplement, this is your employer plan, will act as these two things here. So this here would substitute for these two things here. Or we're going to offer you all in one, similar to this. But remember, an all in one, although it doesn't show it, you still have to pay for Part B. Regardless, you always have to pay for Part B because that money goes, to supplement financially these things. But what is the here is that when you retire, you don't only have an employer option, you also have the Medicare option. So you have actually four things to choose from. Okay, so something that happens also that could be a huge problem is called COBRA. And we call it the COBRA trap. So this is something to think about, whether you're stopping retirement and you want to go for COBRA because you been laid off, or you want the group for your family and so on. So what can go wrong with this? So what is COBRA? COBRA stands for Consolidated Omnibus Budget Reconciliation Act. It's a federal law that says if you lose your job for whatever reason and uh, you can continue health insurance for a limited time. So this is not forever. And there's something called CalCOBRA. CalCOBRA extends the time for smaller employees. So there's COBRA and CalCOBRA. They're typically expensive because you're paying not only the premium contribution that you normally pay with your employer, but you're also paying your employer side. So they have to be pretty expensive. Less people do go have COBRA. So what is the trap? The trap is you're working, and here you turn 65 and you become Medicare eligible. And as I said earlier, you don't have to worry about Medicare if you have active employment because your penalties would be waived once you finish your active employment. Then you go on COBRA. When COBRA starts, the day COBRA starts, Medicare becomes your primary, COBRA becomes your secondary. So the problem happens is that employee never signed up for Medicare. They thought they never had to sign up for Medicare. They never signed up for Medicare here or here. And now they're sitting here and they never signed up for Medicare. COBRA, they have no coordination. They don't know if you signed up for Medicare or not. They keep paying as if they were the primary. So you go to the hospital, have an operation, they will pay for it. And you're happy and you think you're getting great coverage. Then one day in the future, they realize, oh, wait a minute, we've been paying you all this as if we were your primary insurance, but actually we're only your secondary insurance, and it's not our problem if you signed up for Medicare or not. That's your problem. Therefore, we're gonna claim back all this money that we pay you. And they do it routinely. And people think that's not true. they do it. We have many cases that people came in that trap because they thought, I paid my premium, I got the coverage, I got my operation pre-authorized, everything was great. But COBRA says, well, that's not our problem. We have no way of knowing. And somewhere in your COBRA documentation, somewhere on page 54 in small print, that says, if you're eligible for Medicare, you need to notify us. So most people don't overlook that. So that's the first trap. The second trap, again, you're Medicare eligible. You start COBRA, and not only that they're going to claim this money back, but if you're on COBRA a long time, you don't have the special enrollment period, and you don't have a guarantee for a Medigap. So you cannot go buy a Medigap if this period is beyond the 6 months for applying for Medicare. So you could also fall into that trap. The third trap is you were not eligible for Medicare. You were below 65. You retire, or you lose your job. You get COBRA, and at one point you become Medicare eligible, but you're happy with COBRA. You continue COBRA. You never sign up for Medicare. So in this case, once you become eligible for Medicare after COBRA, Medicare becomes your primary insurance, and COBRA has nothing to do with you for 90% of the cases, which mean that they will continue paying you. They don't care if you signed up for Medicare or not. And they realize, oh, you didn't sign up, but now we found out, and now we want everything back. So again, this is really could be quite devastating. In summary, before you retire, you need to ask yourself, do I need to do anything about my HSA? Do I like my employer plan? Does it make sense to me? When should I sign up for original Medicare? Because you're not going to get an overnight appointment with Social Security, so you better plan it. Am I getting on COBRA for any reason? Do I understand the traps I can fall under? But if you take care of all these things, you should be able to start Medicare the beginning of the month, immediately after your group health insurance, the first day of your retirement, with absolutely no gaps, if you take care of all these things ahead of time. So in summary, you again have these 4 options. So we tell people not to be blindsided just with the employer plan. Look non-employer options as well. Coordination. You might hear about coordination of benefits. So if you are actively employed, the employer greater than 20 employees, your employer plan is always your primary. That's your primary. If you have Medicare, Medicare will be your secondary. All other cases, if you're actively employed for a small employer, if you're retired, if you have COBRA, Medicare is always your primary. Whether you signed up or not, it's going to be your primary insurance. So, scenarios before we wrap it up. A single person still working, date of birth 1950, does not have an HSA account, 40 plus work credit, never signed up for Medicare A and B, wants to retire at age 75. He applied for Medicare the next month after he retired. Smooth transition. He's automatically granted a special enrollment period. He has his form to take to the Social Security, and he make that transition very smoothly. Second case, same scenario, enrolled in an HSA, contribute to the maximum, never signed up for A and B, will retire and want to apply for Medicare. He's been paying the HSA, but since he's 75, and he didn't stop his HSA contribution 6 months before the effective date of his Medicare, he gets a problem with the IRS. Part A is deemed effective, and he will be subject to IRS penalty for the excess contribution. What do? What we tell people to do? Quickly withdraw that money out. And I've had actually people from Stanford in that situation, and they can, their own contribution, they can themselves go and take out. But the problem is they go to the employer and say, could you please reverse all these things that that you put in for me? And employer just like throw their hands in the air and said like, we don't know how to do that. So that's kind of a problem, right? The only thing about it is the IRS enforcement is not so strict at that point, but it could be, right? But it's, it's a hole there. COBRA, again, employees terminated at the end of 2023, 68 years old. Employee was offered COBRA starting January 2024, never signed up for Medicare. Very happy, had no problem with COBRA. The problem is COBRA is a secondary starting January 24. COBRA decided to recover all the bills that were paid until the date they found out, and that could be huge. We've had people come in with bills that COBRA is trying to recover for well over $100,000, and then we have to really go and unravel. So in this situation called HICAP, we can go and find out who said what to whom, and there's something called equitable relief. We've been very successful to find out who gave whom wrong information and get all that reversed. But it could be a very, very stressful time for people. So take away from the presentation, understand basic Medicare. When are you eligible? Enrollment, original versus advantage. This is basic, just the very basic. Understand that you can delay enrollment if you're actively employed, because that gives you the right to waive the penalties. The penalty will accumulate, but they will be erased if you can prove that you were actively employed and covered under an employer plan. You will be granted a special enrollment period if you delayed Medicare with no penalties. Important to evaluate Medicare with and without an employer retirement plan, just to get a sanity check. It's well worth your time. Avoid conflict with Medicare, HSA, and COBRA traps, two very important conflicts, traps to avoid. Understand the coordination. Understand Medicare is only your secondary if you decide to take it while you're employed. Otherwise, it's always your primary, whether you signed up for it or not. What we do at HICAP, we do one-on-one in-person or phone counseling. We look at your specific situation. We assist in enrollment. I should say we don't assist in enrollment with Social Security, so we don't get on the Social Security on the phone and try to get an appointment for you, unfortunately, but we can advise you how to go about it. We can assist you if you're trying to buy a supplement or Part D plan, anything with Medicare. Once you're enrolled, all these extra plans we can help you with. Assisted appeals, and this is really more if you're denied something, we can always go back and help you draft an appeal that could make sense, that have a better chance of going through. We have a hotline, second line kind of Medicare line for counselors that we can call them on your behalf. You don't have to be on the phone with us. We can call them and sort out whatever issue that is pending for you. Again, our job is to educate and advocate on your behalf. So I will open it now for question. I know it's a lot of information to kind of digest, but I'm happy to take questions.
Thanks, Maha. That was, as always, super informative, and we did get some questions. The first one I have is, that seems awesome that Medicare, that you call Medicare for people. That is, I'm sure, a huge benefit. So I want to advocate for people using HICAP or the equivalent out of state, which is, to be clear, it's SHIP, SHIP. Okay, so what is the best way for people to find that? Did they just go online and search for HICAP if they're in California, or SHIP if they're not?
So my last foil I'm going to put up is the our contact number. I am personally with San Mateo County.
Mm-hmm.
So, and there's an 800 number. There is the San Mateo number and email. I can understand that some people on the call could be Santa Clara County, which is a sister organization. So you can call them. But honestly, the easiest way is just to Google HICAP and the name of your county, Alameda County, Santa Clara County, and the numbers would just pop up.
Okay, great, thank you. When do you suggest people start the conversation with both their employer, if they're thinking about, they're starting to think about retirement? How far in advance should they ask their employer about, the employer coverage? And also, if they want to talk to HICAP, when would be the best time before retirement to start the conversations?
Definitely for employer that have an HSA, they better be having that conversation with their employer 6 months before they're thinking of retiring. And as far as discussion with HICAP, 3 months before you're retiring, because that's then kind of 3 months is always a good time, because that gives you, in theory, you could sign up for Medicare on the 28th of the month, and it would be effective the beginning of the next month, in theory. However, to get there, you have to call Social Security and get on the phone and get an appointment and so on and so on. So I don't trust that anymore. So I would feel very comfortable with 3 months.
Thank you. Okay, let's see what we've got here. Okay, question is, given kind of the uncertainties with Social Security right now, there may be a gap. If you're Medicare eligible, you get laid off, you might have to wait a long time for an appointment and get enrolled. So what options do you have if you hit that kind of delay?
So this is in the new world. And honestly, I had this problem with somebody with Medi-Cal, where they need dialysis. They had to, they were switching something, and it was kind of a nightmare. But we had to kind of call the agency, and Medi-Cal is easier to deal with than Social Security. Now, Social Security, if you are into this scenario, if you plan it, that's why I say don't wait until the last minute. If you plan it and you see it's not happening, I personally would call my congressperson. They always have somebody in charge of healthcare. So that's always kind of like then they go kick somebody. The second thing, contact us in HICAP, and it's something that we try not to abuse. But there is one person that is in California, Northern California, and this person, we have contact to her in our area. So in the past, if something went really seriously wrong with Social Security, she's a pretty high level person. Something go wrong, and I sent her the information. She does not. I said, "Well, we need help. This is a scenario, and we need help with the Social Security Administration." She never answers any of my email, but the very next day, she goes and kicks somebody, and that somebody calls the beneficiary. Again, we don't abuse that, and I would never use that unless I know that that person who's trying to exercise it have really done their due diligence ahead of time.
That's good to know. Thank you. Okay, for any kind of a Medicare Advantage plan, this is kind of going back to the beginning part of your presentation. If you sign up, I guess if you can go over one more time, if you sign up for a Medicare Advantage plan and then you want to leave it, can you get a Medigap?
So the rules are as so. If you go to a Medicare Advantage plan, you have something called a trial period, and that trial period is 12 months. So provided you don't stay longer than 12 months, the answer is yes. You can go back and buy a Medigap and you still have a guarantee because you are within this trial period. If you are outside of that trial period, you cannot go buy Medigap with guarantee. Well, I should say that the company selling Medigap can choose to take you, but that's their choice. That's not a federal guarantee. So the guarantee is only if you are within that trial period. There are other number of other scenario where you can go back. For example, if you move out of your Medicare Advantage service areas, for example, if you have Kaiser and you move somewhere where there is no Kaiser, then you get a special enrollment period. And if you get that, then you're able to sign up for Medigap with guarantee. That's one scenario. Another scenario is if you have a plan that leaves the market. Let's say in San Mateo County, United Healthcare last year decided to leave the market. They said, we don't want to offer Medicare Advantage in San Mateo County anymore. When they leave, it's not your fault. Then you get back a special enrollment period and you get that Medigap guarantee. So the answer is normally you cannot get Medigap if you are outside the trial period or your initial period, but there are some triggering effects that would allow you to get it with Medicare Advantage.
Okay, thank you. You just partially answered one of the other questions. They're asking if they know in retirement they might be moving, should you not get a Medicare Advantage and just original Medicare if you think you might move? Or does that, if you move, will that trigger it?
Yeah, so
be able
if
to
you
switch?
if you move and your plan is nationwide, then you have no problem. You just have to tell them that I moved to another state and they will quote you the price for that state. So that would be not a reason to change. At that time, you cannot go to an original Medicare just because you moved. So as long as your plan is not offered somewhere else, then you can, all bets are off as you were just becoming eligible for Medicare.
Okay, great. If you are fortunate enough to retire before 65, say you're 63, and you go on COBRA, how does that affect you, your Medicare signing up when you're 65?
So you could keep COBRA, but once you turn 65, COBRA you can continue to pay their premium, but sooner or later they're going to realize that they shouldn't be covering you, so that they're going to ask for all the money that they pay to your provider back. So if you have COBRA and you become eligible for Medicare, you better stop COBRA.
Got
That's
it.
kind of the short answer.
Yeah, thank you. Let's see. What if you move out of the country?
When you move out of the country, you can keep everything unless you know you're never coming back. If moving out of the country does not give you a special enrollment when you come back. So that's actually kind of a sore point for all the expats. So there are expats who are facing the choice. They live somewhere else in the world, and they become Medicare eligible. So they have to make a decision. Do I sign up for A and B and the supplement and the whole ball of wax, even though I'm not using it? Or don't do anything and know if I come back one day in the US and I'm over 65 and I never signed up, I will be subject to all the penalties. So unfortunately, expats are really discriminated against. I speak for that as an expat myself.
Somebody's asking if we send out the presentation. Yes, this lecture will be available in a short time after tonight. You should get notification and you'll be able to watch it again. It's also on the Stanford Health Library website. One more. Do you have time for one more, Maya? I've got one more.
Sure.
Okay. So if you get your employment verification letter, you're all ready to sign up. You can't get an appointment for a few months. Do you need to get another letter, or should you not stop working until your appointment's happening? Will they still take it?
No, you see, the letter would say this person is from was covered under employer plan from this time to that time, and that time should be in the future. That's why you have to be planning it ahead, right?
Yeah.
So the earlier you plan it, the letter could say, if you already know your retirement date, the retirement date could be in 6 months. You can get a letter that says he's going to be covered until the end of the year, right? So that letter is acceptable to the Social Security office. So the earlier you do it, the better. As long as it has the date of your retirement, then Social Security doesn't care. They will take that date. And hopefully, if you do it early enough, you will not have a gap. I mean, honestly, I've never worried about having a gap until recently with all this chaos with Social Security. In the past, it has not been a problem because people didn't not wait until the last week. People tend to do it a month or two in advance. But now I say plan even more just to make sure.
Thanks, Meha. Well, again, thank you for all this excellent information. I feel like I could watch all of your talks over and over and over and still learn something new every time. So I appreciate you always being with us. Like I said, all of our lectures are on the Stanford Health Library website or YouTube channel. You can rewatch them. I appreciate you joining us all this evening. And hopefully we will see you in the future for another Health Library lecture. And Meha, thank you again.
If in doubt, call HICAP.
Yes, please call
Happy to
HICAP.
help.
Yes. Thank you.